Hello, hi everyone. This is Dr. Sharo here. So we are currently having this one gentleman with reduced hearing on the bilateral ear. So as you can see here that there's a lot of impacted earwax on the right side. So what we're trying to do right now is we are trying to remove the earwax with using microsuction. So as you can see that the earwax is quite dry and it's very difficult to try to suck it out because this patient is currently having some pain inside the right ear. So what we are trying to do now, we are using a simplest method. We are using Jobson horn. We try to remove piece by piece. So as you can see, the inside of the canal is quite clean after we remove some of the earwax. So there's quite a messy there. Okay, so when we try to remove it using the Jobson horn, we need to be very careful because you can see there is the area of the canal is quite dry, so we might injure the canal and cause some bleeding, which is can be a very painful and very harsh to the patient. So you can see there's a bit of tympanic membrane there, so but there's still some earwax. So but guys, please subscribe to my channel so that we can help to producing more of this kind of videos in the future. All right, so this is the second attempt. We try to remove it using a Jobson horn. We have to be very careful. As you can see, the tympanic membrane is quite near with the instrument, so we don't want to injure the tympanic membrane. Okay, so we have to use a gentler method. Okay, so we tried to use the microsuction, but then to no avail. That the earwax is quite complicated. As you can see here, we are trying to use it using some of the instruments. We try to remove it very gently. Okay, as you can see, yeah, some of the earwax is trying to be pulled off. So this method is quite gentle to the ear, and it doesn't cause any injury to the ear canal. So you can see there's a smudge there around my camera, yeah, because there's a lot of earwax. So as you can see that this gentleman is already been having this problem for the past 3 months, and the main culprit is because of the using of the cotton buds. Okay, so as you can see, we already removed quite a lot of the earwax, and now we are trying to see is there any remnants. So the next step, we are trying to use this microsuction to try to suck it out all the remaining earwax. Okay, and the earwax is quite dry, and also you can see the ear canal is composed of some of the dry skin and dead skin, so we are trying to suck it out using this microsuction. Okay, so now we are trying using the microsuction. As you can see, it's very difficult to try to remove the earwax, but we can try this, but very little. You can see there's some of the remnant is still attached to the right side of the canal wall. So what we're trying to do, we're using this crocodile forceps, try to lift it up. So you can see it's not earwax, it's actually a skin, the dead skin. Okay, right, so after that, as you can see, there is still some part of the earwax. It's currently resides in the ear canals, so we need to use this crocodile forceps, because it's very easy using crocodile forceps as compared to using any Jobson horn or using microsuctions. There you go. So you can see once again, so now the ear canal is quite smooth and clean, and we can see tympanic membranes. So there's a bit of erythematous there, but can be treated with some medicines. Okay, alright, so settle on the right side. So you can see this is the left ear. So you can see the left ear is already also having this impacted earwax, same type, but the patient still having can hear on the left side. So as usual, we are using a Jobson horns as compared to the microsuction, because you see the earwax is quite dry. Okay, so you see it's very easy to remove using a Jobson horn. As you know, the ear canal is quite sensitive, so we need to be very careful, as the patient will have quite discomfort during this procedure. Okay, and then you see there's a lot of earwax there. All right. Okay, so you can see we need to remove the earwax with a very slowly movement, because the earwax is already attached with the tympanic membrane. So once we try to wiggle it up, the patient might feel something inside there, might feel like a bit painful like that. So right now we are trying to use the microsuctions, but it's very hard to get a grip from it. Okay, so now as you can see, we already have some part of the earwax there. Okay, so we try to remove it little by little. Okay, but this time we are using the microsuction. Okay, that's all.